I'm Concepta, Namukolo, Kwaleyela. I'm a nurse and a midwife. I have specialization in midwifery. That is starting from my master's, PhD levels. I'm here in Bali, Indonesia for the 33rd International Confederation of Midwives Triennial Conference. At this conference, I came to present a poster presentation on a study that was conducted in Zambia on respectful maternity care. The main reason for that study was the fact that right now, especially in developing countries, we've come to realize that, these issues that at times we take not very seriously, issues of emotional impact, psychological impact, sociological impact on pregnant women or on pregnancy and childbirth, we don't take them seriously. But research has recently showed us that these components have immense impact on maternal mortality as well as morbidity. So in that sense, we found out that the Ministry of Health in Zambia, in conjunction with the Midwives Association of Zambia, came up with respectful maternity care guidelines. And these were provided, or maybe I should say, midwives in the country were oriented to respectful maternity care guidelines. But as we did our survey and just asking women around, because they are the recipients of this respectful maternity care, it came to our knowledge that maybe there could be something that we could do to strengthen this respectful maternity care. And that is when we thought of using the biopsychosocial model to strengthen respectful maternity care. So with this study, what we did a longitudinal study in the sense that we interviewed women who came for booking at antenatal care. And the providers of that care were midwives who had initially gone through respectful maternity care orientation. So when we asked the women, they said that the midwives were actually good. I mean, they were not rude or anything like that. So basically, they were satisfied with the care. So what we did was, after the first interview, then we took those midwives without the knowledge of the mothers. We took them through an orientation to the biopsychosocial model. In a nutshell, the biopsychosocial model basically emphasizes the fact that whenever anybody, a client, a pregnant woman, any client comes to you, they are bringing to you, or they are bringing into your space as a professional, they are bringing in their biological being, their psychological being, as well as the way they've been socialized to this home that we call Earth. So that is what every pregnant woman brings to a midwife. And when a midwife understands this principle of the biopsychosocial care, then they tend to understand this client more. So what we did was, after orienting these midwives to the biopsychosocial model and how it works, we interviewed the same women who had been interviewed at booking at the subsequent visits during their second trimester, during their third trimester, as well as 6 weeks after postnatal. And we collected data through the same data collection tool that we had used at booking. These women said that there was a marked difference in the midwives this time around in the subsequent visits. And when we asked them, how would you describe this difference? And they said that the difference could be described as moving from a mechanical provision of maternity care to a more genuine maternity care. It was not something that the women could actually pinpoint, but they said there was this sudden genuineness in the way these midwives were greeting them, in the way these midwives were talking to them. So what was our conclusion? So the conclusion of the study was that when you use the biopsychosocial model to guide respective for maternity care, the impact is more, or it is more strengthened. And that way, the satisfaction that the women express is more. And that way, we as a country, a developing country, are more likely to actually be able to attain the SGD, Sustainable Development Goal number 3, by 2030, and consequently reduce maternal morbidity and mortality. Because when we're talking of morbidities, we are not just talking about physical morbidity. The physical morbidities are big on these women. So we're able to actually reduce maternal morbidity and mortality among our women. Thank you very much.